Welcome, everybody. Welcome. Today is a wonderful topic. We are live. Welcome to Good Gut Live. We do this live, but you can find this recording and this podcast on all stations, Spotify, Apple Music, anywhere you'll find a podcast, you will find Good Gut Live. But the benefit of being live here is I will see your questions. I can answer your questions. Shout out to our Good Gut members who are supporting this Good Gut Live, who are patients of ours supporting our practice, Married to Health. And we really, really appreciate you. I'm seeing people hop on. Hi, everybody. Welcome again. Today's topic is going to be really great. Today's topic is really merging. It really speaks to why we all need to be integrative, why you should have an integrative practitioner, hopefully. We're going to be talking about gut health and inflation. I know a lot of us are just seeing prices out there. We're seeing the cost of food, taxes, just everything kind of going up. So I really want to get kind of these big topic ideas. I was really inspired by a conference I was just at. So I'm going to break some things down to you. I don't want it to get too in the weeds because we could be here for hours, but I want to break things down to you and we will go ahead and begin Good Gut Live. Let's get into it, guys. I love, and again, if you're watching live, we're going to see your comments and questions come through. My name is James Marin. I'm an integrative registered dietitian, environmental nutritionist, the co-founder of Married to Health. For those of you that don't know or don't follow us, and really our mission is to heal with each meal. And with this, we dive deep. Being integrative really means connecting different aspects or really connecting things that seem separate, but really understanding that they are connected and together. One of the things I'm going to be showing you guys some stuff today, but really the idea here, and if you've been following us, we talk about gut health a lot. And for those of you just listening, I'm going to describe what we're going to be seeing on the screen. But I was recently at today's dietitian conference, and Dahlia was at another conference as well fairly recently. And things I saw were like inspiring and it's great. And other things, you kind of see it's like, it just makes you think and go, man, we're kind of missing some of the big picture, right? We're kind of missing some things and we're not getting the full context. And if you guys follow us and know us, we love context. That's what we're all about, is because really when you're lacking the context, you may be going in a completely wrong direction, right? If you're lacking the context that your map is upside down, you may think you're following the map correctly. And this is for us old people who remember paper maps. There's still paper maps out there, I know. So you could be following exact directions, go left, turn right, go straight. But if the map is upside down, you're lacking that context. So that's really the essence of this conversation today, is proper context to connect these dots of gut health, inflation, and really give you all hope that if you are maybe suffering with IBS and SIBO, or just chronic health conditions in general, and maybe struggling financially, we get that all the time. A lot of our patients come in and go, I've spent thousands of dollars on other functional doctors, dietitians, or whatever, co-pays, and your insurance. For those of you on insurance, you're spending hundreds of dollars a month out of your paycheck to pay for you and your family's insurance. So that's a lot of money when you add it all up. So I want to just get right into it. Let's connect some of these dots. So um one of the things I was recently at was a talk, and I hope you guys can see this. Please let me know in the chat if you can't. But I want to share. Yes, there it is. Okay. So we're gonna kind of zoom in as best we can here. But I was at a talk recently, and it was giving strategies for dietitians, and really what the presentation was saying, and I really had to like listen because I was like, are they really saying this? And this is nothing against the presenter. I doubt they'll watch this, but if they do, please feel free to email us or comment. But really the essence of this talk and the context, because I really tried to pay attention. I looked through the slides. I'm like, yeah, this is what they're saying. What they're saying is the idea of recommending people to eat more fruits and vegetables is not working, right? It's clearly not working. And we know I wouldn't say it's not working, but people aren't really following it as well as they could be. But what they're saying is people aren't really following the recommendation to eat more plants, essentially. So instead, let's just tell people to eat the right portions of meat. And I'm like, okay, like that's fine. I'm not here to tell people not to eat meat. That's never our message. We're all about the message of health and wellness, evidence to show you why you should eat plants, how plants can really help your gut health, and we really get into the weeds of that. This kind of irked me from an integrative standpoint because nowhere really in the talk were they really going deep into. They mentioned the benefits of plants, and to give them credit, they were saying some of the benefits of a plant-based diet, and that's great. But really, their message was we should focus on people just eating healthier portions of meat, assuming the rest will balance itself out, right? If instead of people like this slide was perfect, right? It's always about right-sized portions. 3 ounce portions are enough. 50% of US beef consumption is by 12% of the population, meaning 12% of the population are really going for it. They're eating those like big old chunks of meat when they're going to the steakhouse, right? They're doing those like I don't even know anymore, like 40-ounce steak challenge or whatever, right? And so they're saying assess where your client is. So they're essentially saying, hey, just tell your client to eat 3 ounces of meat, and then they'll fill in the rest with fruits and vegetables. That's a big assumption, right? But that's not even what got me. What got me was in the presentation, they did not talk about the fact that we have created this failure, so to speak, right? If we're saying, and they're saying all of you guys watching, we're failing on eating enough plants. Why is that? Why is that? And one of the big reasons I'll say, and this connects to our finances, is did you know your tax dollars fund subsidies? And let me know down in the comments below. Did you know, or do you know, that your tax dollars, if you're a US citizen, and even other countries do this as well, but we're in the US, we're a US based private practice. Let's focus on the US. Did you know that your tax dollars go to fund specifically called the Farm Bill? And in the Farm Bill, we give provisions and we give stipends, we give grants, we give, I guess you can call them, yeah, I mean, overall subsidies in the form of grants and other even direct subsidies to food entities. And for the most part, it's very, very heavily focused on dairy and beef. It also goes into other crops. So we think of like wheat and corn. So we think, oh, great, they give a lot to plants, but a lot of that wheat and corn is livestock feed. So it's indirectly going towards animal-based products. And so without that context, it's no wonder why there's a Taco Bell. Like if I even where I live, if I go out to like the busy street corner out of, the houses and more into the busier areas, there's a El Pollo Loco and there's a Chick-fil-A and and then if you keep going, there's, a Chipotle and there's all these very meat heavy fast food restaurants. And that's not an accident. It's very lucrative to operate a fast food restaurants. We sometimes hear this from like successful media moguls where they're like, I own a Wingstop and I own 12 Taco Bells. And why is it so lucrative? Well, because we subsidize the meat, we subsidize the chicken, we subsidize the pork, we subsidize the dairy. And there have been many who've been vocal about this. There's no wonder stuffed crust cheese pizza came about because cheese is so cheap. They literally gave incentives to food brands and food companies to do something with the cheese. The cheese was like pennies on the dollar. So they came up with stuffed crust pizza. They came up with all these kind of things you think of, oh, it's just some guy thinking of it. Well, no, it's some guy who wants to make money and they're going, what ingredient is the cheapest ingredient? Oh, it's cheese. Let's use more of that and make more money because they can sell you cheese they're getting for pennies on the dollar, stuff it into a stuffed crust, and now sell you that pizza for 15. Now it's probably like 20, 15 or $20 or something like that. So let me know if that's making sense. And I'm seeing some comments come in. Yeah, yep, so troubling our tax dollars at work. Right. And I'm gonna get to this point because again, going back to what I'm saying and showing what I'm showing you is that we have people presenting to other health professionals going, it's failing, just focus on the meat. No, it's not failing. We're subsidizing our tax dollars on this. Like it's not that fruits and vegetables and nuts and seeds and grains and like organic produce is failing. It's just that we are subsidizing it to fail, I guess you could say, right? It's not that it's just failing on its own. So it was crazy to see that, and kind of upsetting. And I just really had to put that in perspective and share the knowledge with all of you, so you would know, hey, my tax dollars are going to this. And then in this day and age when inflation is another tax, inflation is a result of poor monetary decisions by our government and the powers that be. And then they're continuing to subsidize foods that we have in excess, where in the US we waste 40% of the food we make. 40%. So here we are using our tax dollars to subsidize, and then we're throwing away 40% of it. Just doesn't make any sense. And then it doesn't make sense for health professionals to then tell other health professionals, hey, it's failing, and not mention the fact that our government's kind of failing when it comes to why are we subsidizing these foods in excess? Why don't we subsidize walnuts if we're going to subsidize anything? But really, what I would say is let's not subsidize anything for the most part. We'll have some. Again, I don't want to get too deep. I can go very deep into this, so I'm really struggling to not go too deep. But we can subsidize some, obviously have some safety nets, but not to the extreme extent where we are literally crippling people with the number of taxes that we're imposing on them. Okay, I want to get to then something else that was said as well, and then this really ties in. For those of you that haven't heard of medically tailored meals, this was another presentation I heard. And again, I'm not against medically tailored meals. These are basically meals that can be covered by your insurance. And you think, well, that's great. Like my insurance can cover my food, and for the most part, yes. However, it is for the National Medicare Advantage and state Medicaid program. So you can only get your food covered if your insurance is coming from tax funded insurance. And again, I have nothing against, those with lower socioeconomic status getting, it's called Medicaid nationwide. Here in Southern California or California, it's called Medi-Cal. Medicare, you're all familiar with. It's those who are elderly, who are on, Medicare. They get basically tax funded insurance. Okay, great. Thank you so much for watching. We really hope you're learning something, and we really hope you know by now, Married to Health does everything with the patient, with our population in mind. So everything we develop, from our one-on-one care to our programs, and even we extended that when we developed Gut Nurture, it's all with you in mind. What our patients don't like to talk about are stinky farts. If your farts are smelling like egg, if they are smelling foul and clearing a room, you are likely having an overgrowth and a lot of issues going on. We developed Gut Nurture with you in mind. Amongst many other things, it is low sulfur, and it actually helps with hydrogen sulfide overgrowth, or really that overgrowth that's producing that hydrogen sulfide gas. If you're like, what the heck are you talking about? Click below, learn more, and get your hands on some Gut Nurture. Or, it can be great. But now what we're trying to do here is say, and let me just tie this all in. We are subsidizing the wrong foods with our tax dollars, which is making people unhealthy. A lot of people are sick. We all know someone with diabetes. We all know someone with cancer. We probably all know someone now with gut issues, and they're all related. And that's what we usually talk about. So let's use a bunch of our tax dollars to subsidize cheap, processed, sickly animals and food. Then people get sick. And then sometimes people, I mean, this can go down many rabbit holes, but let's just keep it pretty simple. People get sick. People can't afford to take care of their illnesses. So now let's take more tax dollars to give people health insurance to take care of their illnesses. Now let's take more tax dollars to cover medically tailored meals, which now it's the right food, I guess, and take care of these people. We could do that, I guess. That's an option. Someone's saying such a good point, and yes, upsetting. But do you see where I'm going with this? It's that, and I'm gonna pull this up. I want to pull this up really quickly, so bear with me. But it's the idea of integrative medicine. It's the idea of just we're taking care of the symptoms, not taking care of the root cause. And this is really evident. I'm going to pull up a graphic that really shows this. Let's see how quickly I can pull this up. But it's the idea of by not really using the root cause, it's like the sink is overflowing, and instead of going to the drain or turning off the water, we just continue to get mops, guys. And this can go for your care specifically. Is your care team I'll try to find the graphic, but until then, let's see. Perfect. Is your care team continuing to get mops, right? Your sink is overflowing. You started with constipation and gut issues and headaches and migraines, and now it's diabetes. And so now they gave you migraine medication. Now they're giving you insulin and metformin, and now the metformin has hurt your liver, and now you have high cholesterol, so now they're giving you statins, and then now the statins are making your blood too thin, and you're getting blood pressure issues, so they give you a blood pressure medication. Now your liver's getting overwhelmed, your kidneys are getting overwhelmed, so you're on a do you see where I'm going with this? You keep kind of kicking the can down the road. The sink is overflowing, and we go, here's a mop, here's a towel, here's a pump to pump out the water. Can we just turn off the water, right? Can we just turn off the sink? Let's get to the clog in the pipe, right? Let's get to the root. But we don't seem to be doing that. And now going at a macro level, it really culminated in this last talk that we saw. And I'm going to explain it well for those of you just listening. This talk was for entrepreneurs. So for dietitians who want to be entrepreneurs, right? And it's really breaking down this idea of like, okay, if you're someone who wants to be entrepreneur, here's what you need to make. And I'm going to zoom in, and sorry if it's a little blurry, but let's see here. So for any entrepreneurs out there, comment down below. Let me know if you understand this. This can seem crazy. And for those of you just listening, it's basically like an accounts receivable. It's basically taking out expenses, and it's a net pay equivalency. It's basically a cost breakdown where, just to simplify it, it's like if you make $90,000, you don't take home $90,000, right? For those of you even with W-2 9 to 5 jobs who aren't, working for yourselves, you make 50 or 70 or $90,000 a year. That's not what you take home, right? Because there's taxes, you're paying Medicare, you're paying for Medi-Cal, you're paying Social Security, the government, both federal and state, take away from your paycheck, right? So the same is true if you're an entrepreneur. But over 15, and it's climbing every year. Over 15% of what's being taken away is just the taxes alone. It's just taxes. So literally 15%. This is like the base of it, right? This isn't it's way more than that. It gets close to like almost 40% of your paycheck is being taken from taxes, guys. And these are taxes to fund the farm bill. Like I just mentioned, these are taxes to fund medically tailored meals for those on Medicare and Medi-Cal. And this is to fund Medicare and Medi-Cal for people who are sick from the food that we're funding with our taxes. Does that make sense? Right? It doesn't make sense. So it's even hurting, and we're seeing it hurt even businesses. You're seeing restaurants close, you're seeing businesses, raising prices. It's because taxes are increasing, or it's one of the reasons. One of the reasons is taxes are increasing. Taxes are increasing because we're making bad decisions with our taxes. This creates stress, guys. Not only is it creating foods that aren't ideal and healthy for us, it's creating stress for business owners. I'm sure it's creating stress for all of you who get paychecks and are like, where the heck's my paycheck going? And really it's frustrating for us as well. It's like, why are we getting more mops instead of turning off the leak from the source, right? This applies across the board in your care. This applies financially. This applies to your paycheck and your work. This applies, unfortunately, to politics. I know some of us don't like politics, but yeah, I'm going to read some comments. Thank you for being the voice we need to hear right now. We all just have to be brave enough, my friend, and you're truly speaking truth. Thank you. Thank you, guys. I appreciate that. You're amazing. Thank you for being a light in a very dark world. Someone saying, agree, we need more people like this in the world. Yeah. And guys, a lot of people are this. I think a lot of us see this, and you guys are seeing this as well. But we just can't keep really doing this anymore. Someone from YouTube, thank thank you guys again. Oh, thank you guys. We appreciate you and all you guys watching, and um we appreciate all of you. We appreciate our patience and our community that allow us to have this platform truly. And we're a small voice in a big ocean, but a lot of our provider friends, our doctor friends who are integrative, who have this integrative mindset are seeing this, guys. It's just not making sense. And so the hope, I want to get to that sooner rather than later, okay? The hope of all this is really going, if we can opt out of this broken system, that is truly amazing. And what I mean by that is it's nothing really extreme. It's not as extreme as you may think. I'm not telling everyone to pack up and go to a farm and live off the grid um or anything like that. It's not as extreme as you may think, honestly. But truly what we've seen, and from our reading, from our research, from doing this for over a decade, guys, which is crazy. That's where all my gray hair came from, is doing this over a decade and being a dietitian, being in the health field, seeing some really screwy things as well as some really great things. And even from my own experience as being a morbidly obese child, from, I mean, I had arthritis as like a preteen. I had eczema and allergies and migraines, and I was, yeah, just sick. I probably had pre-diabetes and didn't know it. Um, from seeing that, the way, and I'm seeing it even today, is opting out. And what I mean by that is opting out of these systems that are making you sick, opting out of these systems that are sucking our tax dollars, right? Because if you can truly be healthy, if you can get to the root, always say, and this is our advice for even our patients, is start with yourself. It's really easy to get caught up in like, oh my gosh, I gotta, oh, the politics, the presidents, the senators, even local politics, oh my gosh, the school board is so dumb, and the county legislators are so dumb, and blah, blah, and get all riled up. But take it first with you. How are you doing? Take time for yourself. Whether you pray. Whether you can take some time off, take a nap. I mean, I know it sounds so simple. I go from this huge, I know we're in an election year and it can get crazy, but focus on yourself. You really have to focus on yourself. And it's not to say to be selfish, but if you're not good, anything you're doing won't be good. Let me say that again. If you can't swim and you're trying to save all these drowning people, it's not going to work out well, right? If you're drowning in symptoms, in gut problems, whether it's constipation, diarrhea, migraines, eczema, it's all related to the gut. If you're drowning in symptoms, you're not going to show up as your best self, whether it's for your family, your friends, your extended family, your HOA, your PTA, whatever else you're doing. It starts with you, right? So the most powerful thing we all can do collectively is, it starts with, yeah, you know what? I'm going to eat fast food a little less. I'm going to opt for trying, James and Dahlia and Mary's Health has been talking about dried lentils and dried beans and soaking them yourself for years. I'm finally going to try that and save myself money immediately, and also helping my gut health. So then, oh, wow, you know what? Maybe I don't need such a high uh, insurance premium every month because I'm feeling great. I feel so healthy. I hardly use it. Great, cancel it, right? Do an HSA, FSA, where it's a tax write-off. You're paying for it directly, but since you're not using it, you're paying much less, right? There's I can do, and let us know down below, guys, or let us know in the comments if you want us to do just a whole episode on like saving money in specifically like insurance. We can do that as well. Dahlia and I have done that ourselves, but But anyway, but I'm giving kind of just an overview of this kind of disconnect, right? Again, going back to that sink overflowing scenario where the sink is overflowing, guys. We have a diabetes epidemic. We're approaching an IBS epidemic where we have a heart disease epidemic. We have all this disease and we keep just kind of getting mops. And it's time for a lot of us collectively to go, no, we gotta turn off the water and fix the clogged drain, right? Even better, let's repipe the whole house and make sure it's healthy copper pipes that are really functioning well, right? We're not using the lead or PVC, and the analogy can go on and on, but that's the idea. And it starts with each and every single one of us. I'm seeing some more comments come in. Um, if my taxes were going to things that make sense, I would be very happy to pay my taxes. I do like my tax money going to firefighters, ambulances, services, school, but farm bill, that's rough. Yeah, I agree. And yeah, I mean, look, the whole tax, I mean, that's a whole rabbit hole in and of itself, but yes, we all can agree. I love firefighters and police and ambulances and schools and all these things are wonderful 100%. But right, when it's going to subsidize um Syngenta and Cisco Foods and Cargill and all these huge multinational food companies that are worth billions and billions of dollars, and then they get billions and billions of dollars of our money. Wow, like why? And when we're subsidizing, also I have to really call out massive healthcare companies as well, these massive hospital systems that are nationwide that are also sucking funds um, from our tax dollars, both state and federal, in order to really prop up their sick care systems, right? I'm not a fan of that. Um, Someone saying, "Yes, please, can't." I'm guessing can't wait to learn more about saving money on insurance. Yeah, I love that. Well, thanks for the comment. I would love to do a whole episode on that as well. We've saved thousands and thousands of dollars a year on our insurance, but the biggest first step, guys, because Dahlia and I, if you've watched our previous lives or episodes or heard us on other podcasts, we were not healthy people. We've been on this journey for multiple decades, just getting ourselves healthy. Dahlia has the best story with that. Which is, I mean, Dahlia had PCOS, IBS. She had all the acronyms almost you can think of. She had hyperlipidemia. She was 60 pounds heavier than you see her on Instagram. And it was our own journey of getting to a place where, like, wow, we feel so healthy. It doesn't make sense for us to have insurance anymore. Wow, we're not opting into, we used to eat at Taco Bell and Del Taco, McDonald's, because it doesn't make us, it really doesn't serve us. It doesn't serve our health, and now the bonus is we're not buying into these companies who are complicit and okay with taking our hard-earned tax dollars, right? And using it to subsidize junk food. It's just not okay. Thank you so much for watching this video. We know you're probably getting quite a bit from it. It can be a lot of information, can be overwhelming, and we totally get that. Dahlia was there not too long ago suffering with IBS and SIBO-like symptoms. She was hunched over very often, bloating, gas, constipation, diarrhea, skin issues, hormonal issues, the list goes on and on. So we know this. We've been in practice now as registered dietitians for over a decade, and we created our Good Gut SIBO IBS program for you. If you're experiencing IBS, SIBO symptoms, IMO, SIFO, the list goes on and on. If you're like, I'm not really sure what this is, click down below. We have a free assessment for you, and that'll likely lead you to our Good Gut SIBO IBS program, which is chock full of information we wish we had. It's information that we're giving to our patients, so it's all at your fingertips in one package. It's 7+ hours of video. It is dozens and dozens of handouts. It's tailored meal plans and recipes to truly help you get to the root, to truly help you understand what's going on so you can truly heal with each meal. Check it out down below. So yeah, I don't know. I just really, this was on my heart to talk about, guys, and I really appreciate you all that are listening and maybe are already connecting these dots, and hopefully this helped you connect more of the dots. I want to also point out there's this really cool 2019 study. It was actually done by the American Heart Association and some of their staff and researchers. But what they found is that a healthy diet. So for those Americans that are on a fairly healthy diet, this is a diet roughly hovering in between the Mediterranean, better than standard American, kind of in that spectrum. It's not even, I wouldn't say it's even the most optimal diet, but it could save $88.2 billion a year. This is annually for just the United States alone. What could the United States do with 88.2 billion extra dollars a year? Maybe we wouldn't have such a big deficit. Maybe we could use it like for more of the schools and firefighters and just really great things, right? So yes, it's holding our politicians accountable, but the best way we can hold them accountable is to hold ourselves accountable. It starts with us. The reason why some of these not so good players in the game have so much power is because we are handing them our money, right? So if we individually can opt out of the kind of the hyper processed food system, the sick care system, if we can reduce our medications, if we can reduce even some of the supplements, guys, even some of the supplement companies are not great. If we're taking the chips out of the game, they have less chips to play with. They're not going to gamble so much of our money. If they're going like, wow, more people are healthy, like Ashley and Joe and James and Dahlia, wow, they're not giving money to these big multinational corporations for insurance and health insurance. They're not giving money to these big corporations who are running these fast food chains, right? They're not giving money to these supplement companies who are also trying to now lobby our politicians. So the list goes on and on, guys. But overall, our biggest kind of, I guess, want to say call to action is it starts with you. It starts with all of us individually. We are our own little kind of satellites, or I like to think of us as all little droplets of water. And once we realize that we're healthy droplets of water, we can come together and make a massive lake, river, ocean. We are this massively pure and healthy bottle, not body, not bottled water. Don't drink bottled water, but body of water coming together to do amazing things. And we're seeing that, guys. There's pockets of hope. There's wonderful things going on. We have so much hope for the future. And just so much hope for all of you, so much hope for the thousands of patients that come through our practice that are getting healthy, that are overcoming their IBS and SIBO and even Crohn's disease, ulcerative colitis. We just had our dietitian meeting today where many of our dietitians are just, we come together in powwow every month and just share amazing patient stories of like their A1C was 6.8 and now it's 4.6, right? Their cholesterol, they lowered it by 16 points just in 1 month. We've had IBS patients of 22 years be like, this is the best I felt in 22 years, right, of dealing with IBS. So it's totally possible when you're able to start with yourself and truly help yourself feel and be well and healthy. It ripples into your family, into your spouse or your significant other, your children, your extended family. You become this light, this beacon to the world. And then connecting it back to today's topic with inflation and finances and taxes, you are decreasing that money going to these things. You're like, I don't need the Medi-Cal. I don't need the Medicare. I'm good. I'm healthy. I'm feeling great. I'm going to go to a insurance share system that's outside of the system. I'm going to give my money to a healthier company that is an insurance share system where we all kind of share. And that can be in the next episode where we get into the nitty gritty of that, of how to save money with your insurance. And it's still going to cover if I do break a leg or get into a car accident. I'm not saying to anyone, disclaimer, cancel your health insurance or anything like that. But there's much better ways to do it, especially if you're feeling good, if you're healthy, and to just be smart with your money, guys. Make that dollar stretch. And really, all of these things check so many boxes. We eat lots of plants, and thankfully, plants for us, I mean, and for many of you, are very expensive, guys. I don't know if you've seen a big bag of whole grains, whether it's brown rice or wild rice or quinoa at the grocery store is much cheaper than even like one Chick-fil-A visit. A big bag of dried lentils or beans or peas is much cheaper than that Taco Bell drive-through, right? You can feed your family for the entire month, if not months, on that versus one trip to fast food. So it's just rethinking, guys. It's understanding these things aren't serving me immediately and even long term. These same companies who are promising me a cheap meal are lobbying our government and they're receiving my tax dollars in order to give me that cheap meal. Enough is enough, right? We have to opt out of this. So if you enjoyed this topic, let us know down below. We're excited to bring you more topics like this. I was inspired, like I was showing you and explaining, just, hearing other health professionals kind of give some misguided information really upsets me. And so I have to just correct it. I did correct it. I raised my hand and asked questions and just kind of pointed some things out there. But I also want to do it in a larger scale as well. This will live on and we can save it, we can clip it, and it'll live on. So we need to do that as health professionals, holding each other accountable. As health professionals, we hold our patients accountable. As health professionals, we look toward a regenerative nutrition, a regenerative healthcare future where when you're in our care or in true healthcare, you become healthy. Right now, when you're in the average healthcare, you're staying sick. How does that make sense, right? So we need to change that. And thank you all again. I hope you enjoyed this topic. It was fun for me. You know me, I can talk forever, but I love it. And I thank you all for the comments and the feedback. And let's see. I'm getting so right. You're one of my teachers at FRN, John Robbins longevity class. Probably Ocean Robbins. Yeah. Also says if we started eating more plants, we'd have to close most nursing homes and other places. Yes. Yes. Keep us posted and we will be there for the other topic. I love it. Yes, it is. I mean, yeah, nursing homes, hospitals, guys, it all starts with you. You are the key. You are the key. And let me say this, you've probably heard us say this over and over again. The most important ecosystem is your inner ecosystem. That's your gut microbiome. Your gut microbiome is special. It is unique. It is vital. It is important. Take care of it. You take care of it every single day with what you decide to eat every single day. That's why our tagline is heal with each meal, guys. Literally, with each meal, you are shaping and healing and providing for your inner ecosystem, your gut microbiome. Like I said, it'll diffuse and have massive ripple effects, the likes of which we can't fathom, right? But really, what we fathom is this amazing ripple effect. If enough of us do this massive ripple effect where we close some nursing homes and some hospitals because we don't need them as much, where we save on our tax dollars, where less taxes are pulled from our paychecks and our businesses, and we get to then reallocate those funds. We get to use them for something else. We get to have energy and play with our family and have a healthy relationship with our significant other. I mean, the ripple effects just continue and continue and continue, and it all starts with you healing with each meal. All right, guys, on that note, I'm out. I'm gonna end on that high note, on that high hope. And again, if you want to connect with us, guys, go to marytelt.com, click down below for all of our links where you can plug in to our newsletter so you don't miss upcoming in-person events. Guys, we're really excited. Next year, we're likely going to have a really great in-person event, so make sure you're on our email list so you don't miss it. Shout out to our pre-sale is still going on to June 15th for our Good Gut SIBO IBS program. It is the only 100% plant-based way or solution for your IBS, SIBO, SIFO, IMO, so this bacterial and fungal and microbial overgrowth. So check that out. marytout.com will have everything and you can connect with us further. Thank you all so much. Thank you all for joining the live. For those of you watching later, we'll catch you on the next live. Remember to heal with each meal.